Hello and welcome to Embracing Senior Health, sponsored by Embrace Hospice. I'm your host, Candace Howell, and today we're going to focus on Veterans Affairs, such a very important concern in every community and right here as well. So I'm joined by Charlene Hope, and she's the Chief Nursing Officer for Embrace Hospice, and Wendell Allen, the Horry County Veterans Affairs Officer, with us today to talk about veterans. And thank you both so much for joining us. This is very near and dear to my heart, because my dad and my stepdad are both veterans, one of which received a Purple Heart in Vietnam and is receiving these services. So I want to tell folks at home really what we're looking at with veterans and some of the things that they face.
In Horry County, there's over 30,000 veterans in Horry counties, and most of those have spouses. The things that the Veterans Affairs Office does for veterans is we help them with their claims and their benefits. We can help them get into the healthcare system. And
Charlene, you're a veteran. Talk a little bit about that and what this means to you.
27 years as an Army nurse, and it's really very exciting to know that there's such a great Veterans Affairs office here in Horry County.
And so when we were talking a little bit before the show, we were talking about who are our veterans, you know, because I think a lot of us sometimes think automatically, my mind goes right to my dad. My brother just retired from the Air Force after 20 years, but I don't think about him that way just yet, even though he is a veteran. Yeah. Who are our veterans? Paint a picture.
Our veterans, we've got World War II veterans, and we've got veterans from Vietnam era, Korea, and believe it or not, from the Gulf War, Afghanistan, and Iraq. So we've got veterans that are 92 years old or older, and we got guys that just coming back from the desert that are only 19 years old.
And Charlene, why was it so important for Embrace for us to focus on the veterans? What does it mean to embrace hospice?
Well, number one is our owner operator is a 27-year Army vet as well, Kevin McHugh, and I as well. And it's very near and dear to our hearts. Both of us have had many family members that have been in the military. And we see at the end of life that our veterans are very, very special. They need to be recognized, and they have a lot of different needs than the normal person that might be at the end of life.
And we were talking too before that veterans are, again, any age that you can imagine that's been in a recent war, even our guys and gals that are coming back right now and that are, you know, 20s. What are we starting to see out there for our veterans, and what are some of the issues that they face?
The biggest issues I see today in the healthcare system is for your Vietnam veterans, the effects of Agent Orange when they cause them diabetes and heart conditions. The biggest problem we have is with our young veterans, they're 19, 20 years old, that's coming back from Afghanistan and Iraq, is traumatic brain injuries when they were hit with improved explosive devices, you know, in combat. Another problem we have is these young kids, they're doing 2 and 3, sometimes 4 combat tours, and they're being diagnosed with post-traumatic stress before they come back home. And that's one of the things we're looking at.
And the other thing too, you know, so you touched a little bit there on some of the medical things that they'll come back and be faced with. And sometimes it takes years for some of those things to manifest. What are some of the conditions that you're starting to see that people need to know? If you're seeing this, like we were talking about diabetes just a moment ago, if you're starting to see these things, you do have options.
Oh, yes, yes. The first thing I want to tell you to do is, you know, if you're a Vietnam veteran or if you just got back from the Gulf War, 2 things. Go to the VA, get into the healthcare system, get a Gulf War exam, get an Agent Orange exam. They will tell you what the conditions are and what's going on with your body, so that way you can get the correct medical attention.
And the other thing too, I think sometimes, you know, our service members come back and they're a little proud. You know, they don't necessarily want to say, I might need some help. I might need, you know, to know what options are available to me. But the loved ones need to step up too, Charlene, don't they? They need to be able to know what their options are.
Yeah, and sometimes the loved ones live through everything they're going through. And they're the ones that are taking the brunt of it. And they have to step up and say, where can I go? Where can I go for help?
So here in Horry County, where can they go, Wendell?
Go to my office. Horry County Veterans Affairs Office, 2830 Oak Street in Conway. Call me, 915-5480. I will help you with all that stuff. If it can't get you a service-connected disability, then there's another program. It's called Aid in Attendance. It's for that person that needs the money because they're sick and they can't work.
Well, and the other thing too I want to talk to you about coming up after the break in a couple of minutes too is, you know, I have the pleasure of working with many veterans at Horry Georgetown Tech. I'm a professor out there, and we have programs for veterans there too that I think are really great. And we're starting to see some of the folks that have some of these medical issues but are able to come back into the classroom and are able to get another education. There's so many services available is what I'm getting at, and that's why it's so important that you're here with us on this show to talk to us a little bit about what's really under that whole umbrella. And Charlene, I'd love for you to expand a little bit for us about your history with the military and some of the veterans that you guys get to work with Embrace Hospice every day that have really kind of shed some light on this area and why it's kind of near and dear to you guys. We've got much, much more coming up after the break, so stay with us. And this is Embracing Senior Health. We'll be right back.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
Welcome back to Embracing Senior Health. I'm Candace Howell, and we are talking about in this show Veterans Affairs, and I'm here with Wendell Allen, and I also have Charlene Hope with us again from Embrace Hospice, and again talking about veterans, so very important to our community, and you know, of course we always thank our veterans for their service and say welcome home. I think it's always important to do that when you see a veteran. We want to talk a little bit more in this particular section of the show about what our veterans are facing beyond the medical. They're coming back, they have to go back to work, and we're seeing some really scary numbers out there.
Yes, we are. The veterans that are coming back are twice as likely to be unemployed as a non-veteran. So they're really having a tough time finding a job.
And why is that? What is that attributed to? I would think that, you know, as an employer, I want to hire as many veterans as I can get.
There's a lot of factors in that, you know, and you're right. Most employers do want to hire a vet, but a lot of veterans are, you know, there's not a lot of jobs for a guy that was a security policeman in the military, because there's 30,000 of them getting out, and maybe there's only 4 slots available for policemen in the county, or you know, so the job slots are just not there for the veterans.
And some of the other things we were talking about is that there are other options beyond just going back to work. You can also decide, maybe I want to continue my education. Maybe you stopped what you were doing in your life, you enlisted, you went in, you served our country, but now you're saying, okay, I want to get another education. I realize that the jobs are just not there. Let me retrain. What are the opportunities there for our veterans?
There's some great opportunities, because the veterans now that are coming home have what's called a 9/11 GI Bill. And it pays their tuition, and it actually gives them a stipend to buy books and to pay for their housing.
And SC Works has been a critical element in the community as well. And you mentioned to me during the break that we have some veterans that are working there specifically, and they can really help.
That is correct. South Carolina Works has 2 veterans there that they are veterans, that when a veteran comes back home and needs a job, they will work with them, place them, help them get a job, and they will actually help them go back to school if that's what they want to do.
And Charlene, with Embrace Hospice, you guys have the opportunity of working with some great veterans at the end of life. And tell us a couple stories, if you can, or just some great things that you guys have encountered along the way.
You know, the youngest veteran that we have right now is in his 30s. He came back from the Iraq War with a head injury and a brain tumor. And it's really impacted his family. It's not just taking about the veteran, it's about taking care of his whole family. His 2 little children, that they know their father is not going to be there much longer. So as a hospice team, we get very involved, not only with helping them get to the right place to get benefits, but being there for the family. That young wife.
This is a unique situation too, is it not, with hospice in particular, because, you know, we think of typical hospice and we think of, we have all this time to prepare for this, or maybe we've had a little bit more time, but when you're coming back from a war with an injury, it's a little bit more sudden. and you've got a family who's already dealing with a very difficult situation, and now they're looking at hospice. You guys have a very important job to do. What do you bring to the table that you believe is just so important to those families?
I believe it's the emotional and spiritual support. Certainly finances, we can get them, that kind of stuff, but the emotional and the spiritual support is key. And many of these young families don't have anybody else to rely on. So they rely on our spiritual care counselor and our social workers and even our medical people. And it can be very difficult for the hospice team. You know, we're used to taking care of our World War II vets that are 90 and 93, had a great life, and, you know, they've done everything they wanted to do. But our young vets, it's really sometimes difficult for us as a hospice team to take care of them. And they're very special in our eyes.
Well, and Wendell, for our veterans out there that may have questions or they're interested in getting more information, where do you recommend that they go?
Again, I would recommend that they come by the office, let us talk to them and tell them about what's available. Go to va.gov, it'll give you a good insight of what's going to happen. One of the things I'd like to say, when the veteran passes, that there may be benefits for the widow and the children. So that's one of the things they really need to look at, you know, to contact us so we can prepare them for and let them know if there will be benefits after the veteran passes.
That's a really good point to make. So again, the website and then your office location.
I'm at 2830 Oak Street in Conway.
And the website you said was va.gov.
va.gov, that's correct.
Lots of great information there. If you are a veteran or you know a veteran and you want to get more information, that's a great place to go. Well, we are going to head into break, but when we come back, we are going to be talking baseball. We're going to be talking with the Pelicans about what they do for the veterans, a great organization in this community, much, much more coming up after the break. Stay with us.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey. Many people think that because you've been referred to a hospice services, that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Welcome back to Embracing Senior Health with WMBF News. I'm Candace Howell. This is such a great show. I'm really excited to introduce some folks that we have here with us again. Charlene Hope's here with us again, and we also have Katelyn Guild from the Pelicans. And everybody likes to go out to the ballpark, especially our veterans, and you guys are doing some great programs for them. So Katelyn, tell us a little bit about what you guys are doing out there at the ballpark.
We are so excited this year. It is going to be so much fun. We actually partnered with Embrace, and we're embracing our World War II veterans. This was kind of a brainchild of mine. Both of my grandparents were World War II vets, and both passed away before I got their story. So we tried to figure out how we could capture our World War II veterans' stories. So we've actually partnered with Rod Gregg out at Coastal, and he's going in and filming veterans' stories. And we're using baseball as a platform to show those. So during our Saturday games, we actually are going to air the interviews with these World War II vets.
So if we're sitting in the stands, paint this picture for the audience. So if we're sitting in the stands, we're going to see these stories up on that Jumbotron up there and really be able to kind of turn back time.
Yes, absolutely. And with that, we are also doing a card set. So not only are we doing the interviews with these World War II vets, we also are actually doing a baseball card set of our veterans with their active duty photo and their story on the back.
How fun.
Yes.
Charlene, you guys decided to partner with them on this. What does this mean to Embrace? What a fun thing to do.
It is, and you know, it brings back to living. You know, last year we took a group to the Pelicans of World War II vets, and it was the most heartwarming, humbling thing that I've ever been through. To see these World War II vets be just so proud with their hats and their handshakes and everybody recognizing who they are.
Handshake too.
That's a great handshake.
They
have
just
a great
little
handshake.
That's a nice, strong handshake. You
It
gotta
sure
love.
is.
Yeah, I always love the World War II vets because they're just I hate to call them sweet, but they are so sweet because they have such a great story and they're never afraid to tell that story. Nope. And so that's why I love what you guys are doing, and I'm really excited to come out there and see this. So along with that, will you be doing anything else special for them while they're in the stadium?
When they're in the stadium, Embrace will actually invite them up into their suite for the night, so it's nice and air conditioned. It's a comfortable spot for them. With that, nightly, not just Saturdays, we also are going to ask all of our veterans in the stands to stand up. And the idea is to embrace the veterans. So anybody around them, we actually are asking our fans to reach back, embrace them, buy them a pop or a piece of pizza or whatever, and just thank them for their service. You can never thank a veteran too much.
No, you can't. You absolutely can't. And I love it. That's why I'm kind of grinning, because it's just, and it almost makes you tear up a little bit because you're just so proud of veterans to begin with. But you take that group and they really, really mean something. All of that means something. But this group is just really special because we're losing them. Yep. We're losing them every day. And their stories really need to be captured. Yes. And I think this is just such a great thing to do. With Embrace, you guys are thinking about some really creative, out-of-the-box ways to market what you do. Is this part of something bigger that you guys are doing?
It certainly is, because we have partnered with the VA hospital in Charleston, and we want to have those veterans sent, for their end-of-life issues. Last year when we took one of the veterans to the game, he died 3 weeks later. Barely could make it, but afterwards it was just like, this is the best thing we could have done for this man.
Walk me through taking them to the game. What's that like for you guys as a staff, and what's it like for them?
It was a little hectic for us as a staff. I don't know, you've been in the Pelican Stadium and they're in wheelchairs, they're in the canes, and you're rushing them down, and then we had to bring them onto the field and bring them downstairs and then bring them back up.
But they loved it.
They loved it, and they never complained the whole time they were at the game. So for one moment, their illness and their end of life was gone. It was that moment where baseball, everybody loves baseball, and one of them even had an ice cream cone, and to see him just relish that ice cream cone and watch that game was just such a heartwarming experience for us.
And Katelyn, for you guys, as a staff, as a facility, what was that like?
It is one of the coolest things. You can't even picture it because it's such a feeling. It's such a gut-wrenching happiness. You're so proud and you're just so happy that they're there. We're in the business of making memories, and if we can capture it in that snapshot when they're on the field and people are on their feet cheering for them, that's what we're all about, and that's what we continue to do, and we will continue to do this year.
Well, this is so exciting. So when will it start?
It actually starts on our first day. We're embracing veterans in our in-inning promotion. The first Saturday is the second Saturday that we start. So
perfect. That
first Saturday is I believe, the 15th.
Perfect. Well, it's coming up very quickly. I'm sure you can find more information out about it on the Pelicans website.
Absolutely, absolutely. There's a link under our promotions tab.
And what is your website?
MyrtleBeachPelicans.com.
Well, perfect. Well, we've got much, much more coming up after the break. If you love baseball and you love the Pelicans, of course, and veterans, you definitely have to get out there. This is going to be a great promotion and something really wonderful for our community. And how great for the veterans. They're going to love that. Well, Katelyn, thank you so much for joining us. Appreciate it. And I'm going to have much, much more coming up with Charlene after the break. You are watching Embracing Senior Health. Stay with us. We've got more coming up.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. I'm Candace Howell, and this is brought to you by Embrace Hospice. And we've been talking with Charlene Hope and some other guests about veterans today. And Charlene, you're back with us, and we want to talk a little bit about Embrace Hospice in this portion of the show, and really tell folks about who you guys are as a company.
Well, Embrace Hospice has not been around very long. It's about a little over 18 months. and has come to Horry County at that same time. It was a vision of our president, Kevin McHugh, who is a nurse, and the company is owned and operated by nurses. One big difference is that your clinical leadership are nurses, and that makes a big difference.
And why is it such a big difference? And why is that important to your potential folks out there that are looking at you for services?
Well, I can tell you personally, as being the chief nurse, I get the opportunity to take care of patients. I'm not just sitting behind a desk. I'm not just telling other nurses what to do. I get to be part of what it is, to live what people and our families are going through, and know that what their needs are. What do they need? What do they want from us? How can we help them?
And you guys are really looking at the different segments of the community and educating about hospice. And that was one of the things that we were doing with today's show. You know, we're talking about veterans and how that's viable in our community and why they need to be looking at hospice. And so how are you guys really trying to get out there and educate and be part of the community right now?
Well, I think it's twofold. We want to educate the community, and this is why we're doing this. We want the community to know about everything that's available, no matter whether it's from assisted living to nursing home to veterans benefits, so that they are better stewards of what is out there for them. The other component is to educate hospice personnel so that they can be what they need to be. It's a very difficult time with compliance. Medicare, CMS, it's really making it a challenge.
Yeah.
And if we can educate other hospices, not just Embrace, but others, then we want to be on the forefront of that.
Well, you guys are definitely leading the charge, and I think it's just such a great thing to look at veterans as part of that, and so many of the other things that we'll be talking about with these shows. I think it's so great. Well, Charlene, appreciate it. Again, if the folks at home want information about hospice, what's your website?
It's www.embracehospice.com.
And they'll be able to go there, find more information out about hospice. And it is something that, you know, it's a touchy subject, but it's very important. So again, we thank you for joining us, and we thank you folks at home for joining us as well. This has been an edition of Embracing Senior Health. And again, it is brought to you by Embrace Hospice, and it's every Friday at noon here on WMBF News. Have a great day.